Welcome to week 7 of our online facilitation lecture. Today, we'll be discussing evaluation of health resources, health services, which is a continuation of Unit 5 that we started last week. The learning goal for students under evaluation of health services is, after studying these units, learners should be able to explain the actions required to develop monitoring and evaluation process as part of managerial process for national health development. Monitoring and surveillance process, as we learned last week, are only to check the deviation of any program or activity from its aim till it reaches to the goal in terms of its resources. These tools, monitoring and surveillance, fail to assess the program achievement. They don't assess the achievement nor the different level of implementation which is done by evaluation, as we will see in today's discussion. Another important point is the purpose of evaluation is to assess the achievement of the stated objectives. So in a program, you have a stated objective that you want to achieve, your aim that you want to achieve. Its accuracy, evaluation assess its accuracy, the aim, the objective as well, its efficiency and its acceptance by all parties involved. While monitoring is confined to day-to-day ongoing operations, evaluation is mostly concerned with the final outcome and with factors associated with it. Good planning will have a built-in evaluation to measure the performance and effectiveness for feedback to correct specific deficiency. Evaluation. What is evaluation? We are going to unpack evaluation. Evaluation simply means the process by which results are compared with the intended objectives, or more simply, the assessment of how well a program is performing. That is the simple definition of evaluation. Another important point is evaluation should always be considered during the planning and implementation stages of a program or activity. It is crucial in identifying the health benefits derived. Evaluation can be useful or is useful in identifying performances difficulties. Its studies may also be carried out to generate information for other purposes. For example, to attract attention to a problem, extension of control activities, training and patient management. So we've seen the definition of evaluation, as well as the importance of doing an evaluation of a program. Reasons for evaluation. For everything we do in life, there is always a reason for it. In nursing, we call it rationale for what we do. And so we want to look at reasons for carrying out evaluation in a program. The reasons for evaluation are as follows. Health services have become complex. You can agree with me that there is complexity in health services in this 21st century. There has been a growing concern about the functioning of in their functioning both in developed and in developing countries. So whether your country is a developing or developed country, there has been a growing concern on the issue of health services. Questions are being raised about the quality of medical care, utilization and coverage of health services, benefits to community health in terms of morbidity and mortality reduction, improvement in the health status of the recipient of care. And evaluations address itself to these issues. The issues I've just mentioned to you, are the issues evaluation address or assess. Elements of evaluation process. We've got processes of element of evaluation process or process of evaluation. And we looked at it, we've understood that evaluation is the most difficult task in the whole area of health services. I want to look at the following components. We've got quite a number of components that we'll be unpacking in today's lecture. One of the components is relevancy. You also have, under relevancy, you want to look at the relevancy or requisition that you make in relation to the appropriateness. What is this that you have requisited for? Is it relevant? Is it appropriate for the service? Is it needed at all? These are the questions you want to ask yourself when you are evaluating a process, a program, I mean. And a good example is vaccination. Vaccination against chickenpox. We all know that there is no outbreak of chickenpox in our country. And so you've ordered for the vaccination. Will you say it's relevant? Of course, it is not relevant because the disease is no longer existing in the world. And so there is no need to order for vaccination for smallpox, I mean. Adequacy. It implies that sufficient attention has been paid to certain previously determined courses of action. For example, the staff allocated to a certain program may be described as inadequate if sufficient attention was not paid to the quantum of workload and targets to be achieved. So you want to look at the adequacy of manpower, even materials, even money, like we covered in the part A of this unit, when we look at the resources, the healthcare resources in terms of manpower, money, and materials. So you want to assess the adequacy of it. The next component is accessibility. What does it mean? It is the proportion of the given population that can be expected to use a specific facility service. So you want to look at the barrier to accessibility. So we mentioned when we at the beginning of this course that healthcare service should be accessible, should be acceptable. We look at the 4 8s of the definition of primary health care. And so you want to assess any barrier to accessibility in terms of the physical uh, aspect of it. Is the distance okay to travel? The time okay? You want to look at the economic aspect of it. The cost, is it affordable? As we looked in the definition. You also want to look at the cultural aspect of it. Is the is this service, is it culturally accepted to the people? So those are the things that we want to assess during we want to evaluate under assessment. And we look at the next point, which is acceptability. That is the next component under evaluation. The service provided may be accessible but not acceptable to all. Example is male sterilization, screening for cervical or rectal cancer, insertion of copper T if the professional worker is male or female, as the case may be. So you want to look, you want to evaluate the acceptability of the service that you are providing, the healthcare service that you are providing. And so it is important to evaluate all this so as to replan or reassess or re-strategize the program, the healthcare service, so that it can benefit the community that you are serving. So the next component we want to look at is effectiveness. It is the extent to which the underlying problem is prevented or alleviated. Thus, it measures the degree at, of attainment of the predetermined objectives and targets of the program, service, or institution expressed. If possible, in terms of health benefits, problem reduction, or an improvement of an unsatisfactory health situation. The ultimate measures of the effectiveness will be the reduction in morbidity and mortality rates. Of course, health services should be evaluated in order to see its effectiveness. Is it reducing the mortality and morbidity rates, which is the main goal of checking or evaluating the effectiveness of health service that is provided to the community. And the next component we looked at is efficiency. What is, we just look at effectiveness. If it's effective, is it efficient? Which is the process of measuring how well resources, money, manpower, material, and time are utilized to achieve a given effectiveness. The following examples is illustrated. The number of immunizations provided in a year as compared with an acceptable norm using cotton gauze to clean the windows or shares during personal work on project time. A medical officer who cannot speak the language of the client, or a professional nurse who cannot insert a copper T, or health personnel processing on long proceeding on long leave with no replacement. So you look at the efficiency in terms of the manpower, in terms of the resources, at the same time in terms of the money. You want to look at the effectiveness. And just like the example has been given, you posted a manpower in terms of a professional nurse to a community, to a primary health care centers in a community, and the person cannot insert a property, and yet you are running a family planning clinic. How would the person, if you have a client that chooses a property, how will the nurse be able to be efficient in carrying out that task? So you also look at the materials. Those are the things we evaluate. And the next component is impact. It is an expression of the overall effect of a program, service, or institution on health status and socio-economic development. Example here is, as a nurse, as a result of malaria control in Nigeria, not only has the incidence of malaria dropped down, but all aspects of life, agricultural, industrial, and social showed an improvement. That is, the social life of the community has shown an improvement to this control of malaria in our context. If the target of 100% immunization has been reached, it would, or it must also lead to reduction in the incidence or elimination of vaccine preventable diseases. So that tells us that the target of a village water supply has been reached. It must also lead to a reduction in the incidence of diarrhea disease. So when we evaluate, we want to look, have we been able to meet our target, that is the objective, that is the goal of implementing certain health services program. So if it's been met, definitely there should be 100% reduction or improvement in that particular disease that we are targeting. So therefore, we've looked at the components, and if all these components under evaluation process, that is the element of evaluation process, have adequately been conducted. Therefore, planning and evaluation must be viewed as a continuous interactive process leading to continual modification both of objectives and plans. Successful evaluation may also depend upon whether the means of evaluation were built into design of program before it was implemented. Evaluation of health services. Randomized control trials have been extended to assess the effectiveness and efficiency of health services. Often, choices have to be made between alternative policy of healthcare delivery. The necessity of choice arises from the fact that resources are limited and priority must be set for the implementation of large number of activities which could contribute to the welfare of the society. An excellent example of such an evaluation is the controlled trial in the chemotherapy of tuberculosis in Nigeria, which demonstrated that domiciliary treatment of pulmonary tuberculosis was as effective as the more costlier hospital or sanitarium treatment. The results of the study have gained international acceptance and usher in a new era of domiciliary treatment in the treatment of tuberculosis. And so I want to say this is where we would end the discussion for this week under Unit 5. I want to say thank you for watching, and